We will be talking about medicalisation of FGM. It will be great. And please do join us as well and share away. It will be lovely to see you all and get your idea of what you think. Thank you very much.
I am Dr. Amr Hassan, Assistant Professor of Obstetrics and Gynecology at University, former Rapporteur of National Population Council. See you soon on Tuesday, 13th of October, on webinar by UNFPA and Global Media Campaign. This webinar to launch media campaign to end FGM medicalization.
My name is Catherine. I'm a nurse by profession. I underwent FGM at age 12, which was done by a medical practitioner. The difference is I didn't go to a traditional circumciser, but it was done by a medical practitioner who by then introduced herself as a clinical officer. So I was very young to know the different categories of healthcare providers, but I came to realize that was one of them. And when she was doing it, she used forceps to pull and a blade. It is so clear in my mind because I can remember the pain. Anesthesia was not used by then, but I will remember the pain when I was being told, be still, something was being pulled, and I know blade and I saw blood. Everybody was celebrating, and people brought it out. The difference was like this was done by a medical practitioner and it was done at home. Though I didn't see a safe environment, but I know the medicalization is not putting it to be so gisty on matters of FGM, because when I grew up, I also wanted to be a health practitioner. In a way, I should also speak up for the voiceless and talk of how it feels. It's no different when you're saying you want to do FGM medically and not traditionally, because at the end of the day, something has been cut, something has been injured. The trauma I carried for some time, especially the psychological, was so hard. And it took me time to accept this person and just learn to forgive. Again, it took me time to carry on the scar that was left. So medicalization of FGM does not make the scar become different. It only looks at it to be so gisty. There are families that will talk about it like if a healthcare provider does it, it becomes different. But the cutoff is there is no difference of who does it. As long as it's FGM, it doesn't matter if it's medically done or if it is traditionally done. So I come out clearly. I do a lot of activism against FGM because I know, despite undergoing the medical bit of it, the impact is the same, the trauma is the same, and it is a way for us to speak up. So I'm really against medicalization of FGM. I say it clearly, and I'll always repeat, it doesn't matter where you do it, the fact remains it's FGM, it is not allowed, and it is not the best, and it should stop.
Saya berdiri di tepi jalan, memakai pakaian ringkas, kemeja T dan seluar jeans, menunggu ayah menjemput saya dari universiti. Kami sedang menuju ke rumah ibu saudara untuk acara ulang tahun sepupu saya Anissa yang berumur 2 tahun. Assalamualaikum, saya ucapkan semasa memasuki kereta. Ibu bapa dan kakak saya membalas, Waalaikumsalam. 20 minit kemudian, kami tiba di rumah ibu saudara. Dan terus terbau aroma masakan rendang, lodeh dan sambal goreng yang enak. Rumahnya penuh berwarna-warni. Daripada baju kurung merah dan biru kepada jubah hijau dan juga abaya hitam. Saya mengambil makanan untuk ibu dan diri saya. Dan kami duduk sambil menikmati makanan lazat. makcik saya membawa sepupu saya yang comel dan dengan bangganya berkata, "Dia disunatkan minggu lepas." Mata saya terbeliak. Tulang belakang saya menjadi lurus. Saya hampir terjatuh dari sofa. "Dia disunat? Anak perempuan disunat?" saya bertanya. Saya tidak boleh percaya jawapannya. "Ya, minggu lalu oleh seorang doktor. Cepat sekali." "Snip, dah habis pun," makcik saya menjawab. Tetapi ini melanggar hak kemanusiaannya. Ini salah," saya menjerit. Kakak saya memotong perbualan kami. Dia berkata, "Kamu juga disunat semasa kamu kecil." Mulut saya digantung terbuka. Itulah saatnya saya sedar tentang sunat perempuan dan saya mendapat tahu ia telah berlaku kepada diri saya. Tetapi, mengapa? Untuk apa? Saya menanya ibu. Ibu menjawab, dalam Islam, perempuan patut disunat. Cara ini lebih bersih. Dan kamu tidak akan berzina. Pada saat itulah, saya memutuskan untuk mencabar mitos-mitos sebegini dan melindungi anak-anak perempuan lain di Singapura. Dan sejak itu, saya telah berkempen untuk menghentikan amalan sunat perempuan.
More important. One of our experience in media that we have like made a video called Sabha. It's talk about an Egyptian girl who Sabha till she grows up, starting from FGM, early marriage, led by VO, by a famous TV and radio presenter here in Egypt. It's called Osama Munir and me. And I think that video on that time has made a great success, that I go to Lebanon and make episode on Al Hurra channel to talk about how new media can be used and utilized for women welfare. Also, one of the experience is that in 2016, we have like an Egyptian girl called Mayar who died on Suez while FGM, after FGM has done to her by a doctor in hospital. At that time, I was a member of health committee of National Council of Women, and I was invited by Egyptian Parliament, House of Representatives, to share with the National Council of Women, where I made there the GM, I have to is reinforced. First of all, we have law in Egypt in 2008 and to the Egyptian Parliament, House of Representatives, and after that talk, like law is reinforced again, trying to make campaigns people by every means. Like that in 2016, we have a celebration with flying candles to FGM. If you look at the picture, you will show that everyone is like putting a candle in his hand. With me, beside me is our which means say no, that we are like posting on harmful practice, that women to early marriage, no to FGM, no to harassment, and no to violence against women. A great impact. After 1 year of the law is reinforced, as I told you before, that we had at 2017, we had our campaign celebration in International Day of Elimination of Violence Against Women. We make like roundtable discussion to think about the law and what are the difficulties and challenges that hinders them that law to work. In 2018, I was selected to be rapporteur of National Population Council in Egypt, which is about characteristics of population here in Egypt. It has many files from family planning and also FGM and early marriage. I remember that one of great personnel whom I met in 2018, UN Women Goodwill Ambassador, Mrs. Jaha Duncan, where I met her and I discussed with her the role of National Population Council, and also I thank her for her role. In 2019, like we have like a celebration from our National Population Council, we have like mutilation. But I think I'd always say that we have like here in Egypt problem that we always remember FGM in only 3 occasions. First time in International Day, second time in National Day, third time when we have a victim who like die after FGM. So I think we have all the time to make like talking about FGM is sustainable. One of the mandates of National Population Council is the file of FGM. So I think we have in 2019 had made a lot of meetings where we started to discuss and evaluate national plan for FGM eradication in Egypt. Where we have like national plan for FGM eradication. And so we started to discuss and evaluate it through various meetings. At the end of 2019, we have like an opening session of conference with the National Council of Hood and the Child, and it was through the annual technical consultation of the joint program between UNFPA and UNICEF. Lately, in this year, 2020, as a sort of this year, we have another girl who died during FGM, is called Nada. So we have launched a new campaign called White Coat Against FGM. White Coat Against FGM, White Coat, he represents doctor, where we like, I collaborated with medical students, all medical students present in Egypt from all different universities all over Egypt. They are under umbrella of something called IFMSA, International Federal Medical Student Association. So a start we made for them training for these medical students. We start to talk to them about FGM. Then we have like make a great number of doctors. Then we started to go everywhere, like a metro, like a station, train station, where we go down to this metro and the train stations. We started to talk to people about FGM. And I think this campaign has succeeded to make an impact, because if you want to fight medicalization, first of all, you have to create a new generation of doctors who think that FGM is forbidden, FGM is against law. So this is what we have done through White Coat Against FGM. White Coat, we talk with medical students. I always say these medical students after 1 or 2 or 3 years will be a doctor. A doctor has a great role. The role of doctor is not only to refuse to do FGM, but he has a great role in counseling. As obstetrician and gynecologist here in Egypt, I has protected a lot of women and a lot of girls. Dr. Amr, please check my girl. Did she need FGM? I told her, no, you don't have to examine it. So I think that doctors have a great role, not only to counsel women. And fortunately, and the great chance that this campaign, White Coat Against FGM, has taken a special award from National Council of Women. That National Council of Women at the end of this year has searched through all the years about all campaigns which was made in Egypt against FGM, and the award, Aziz Hussein and Mari Asad award. Doctor have a great we should have a great participation in media, and this is why that I have go through many TV interviews. Lately I have interview on International Day of Elimination of FGM with Radwa Shirbini. Radwa Shirbini is Egyptian talk show host. FGM is forbidden in ethic code, but we have a problem in Egypt. Although that is forbidden and banned by law, there is like percentage of doctors who are doing it. May do that. Women have trust in doctor, so they bring their girls to doctor. Doctor may accept, maybe for money, maybe for his religious and cultural belief that FGM is necessary for girls, or that FGM is related to religion. Another one doctor have another belief. He says that if I refuse to do FGM to this, if I do an FGM, it will be less, it will have a better impact on the girl. So I think, yes, they are prevented from exercising the profession, but here we have like a crime where the two sides are accepting it. The mom and dad is going to doctor, they pay for the doctor money, so both of them are accepting the crime. The crime is only known when the girl died. So I always say that when we have a victim and when the girl died, then we have like hear it in the media. So as I told you, here in Egypt we have a problem that FGM is noticed only in 3 occasions: International Day, National Day, and when we have a victim. And I think we have to like change culture to always to like and to ask and to engage more journalists and more TV presenters in order to be interested and keen about FGM all the time. What is challenging that I can say to you secret, like when I go every time and in the TV are also gynecologists and obstetrician tells me, Amr, why you are talking about pregnancy? You will get pregnant women. If you talk about infertility, you will have infertile women, and then we get money. But when you are talking about FGM, you will not get gain anything from it. But maybe FGM will bring for you criticism. But I think we have also to work more on mentalities of our doctors in order to make like a generation. So we have to younger generation is a hope to change. And as you show about what we have done. So as I told you, here experience in Egypt, I say that we have to make the message all the time, because as I told you, something like I think like we have like a problem. The most difficult thing to change imprinted in genes. So I think that maybe many people are imprinted in their mind and genes that FGM will protect women from doing bad things. As I told you, we have an law. Yes, it's my question. We have an law, and it was reinforced in 2016. But we have like we didn't like implement the law. We only implement the law when like we have like a crime, when there is a victim, when it was a pleasure for me to be with you today and to share experience. Do you have like any questions or any experience in Egypt? Yes, for sure. Mutilation is
Thank you for that, Dr. Hassan. That was really wonderful. That was really great.
It's nice.
We will have another session with you, I'm sure, to just go through all of that. It would be really good to get some insight from the other speaker, Maria Tahir in the US, just to kind of chip in the US and the Indian experiences of FGM medicalization. And if you have any successful campaigns that you can share with us, it'll be fantastic. Over to you, Maria.
Hi, everyone. Hopefully you can hear me. My name is Maria Tahir, and I am based in the US, and I'm a co-founder of SEO, which is an organization that seeks to empower survivors of Asian backgrounds and other communities to really abandon the practice of FGMC. And one reason that we really focus on Asian communities is because it is something just relatively, or not relatively discovered, but it's only in the last few years that there's really been many countries globally. A report just came out showing that it does affect 92 countries around the globe. And I'm based in the US, as I mentioned, but SEO is a transnational organization and is also headquartered in India. And medicalization is something that is incredibly important to us, and really recognizing that there is a need to have media campaigns and to have social media as well, advocacy campaigns around this issue, particularly because, as I mentioned, within Asian communities, this is something that has just really become into the limelight. And I think in many countries within Asia, it has been medicalized, and it is actually not against the law at this point in time. So you do hear about places such as within Singapore and Malaysia, where it comes as birth packages too, or it's something that is it is enhanced by doctors. Here in the US, I think it's important to recognize that how it can affect communities and particularly diaspora communities. For instance, in 2017 or 18, I'm blanking on the exact year, but for the first time ever, we did have a doctor who came from the community that I grew up in. And I should mention, this is a particularly personal issue for me, as I grew up in a community that practiced it. But there was a doctor from the same community that I grew up in that was charged for performing female genital cutting or mutilation on women and girls. And it just helped emphasize that we are seeing this increasing trend where it is something that is becoming medicalized, unfortunately. And within many Asian contexts, it's something that we see it, there is a few other countries globally, but we are seeing that what's happening are some of the lesser forms of FGMC. And there's this almost this opposition that's happening where we're seeing that the lesser forms are being justified and being considered that since it's not as extensive, it's okay to carry out, and medicalization will help make it safer. And so there are some additional barriers and challenges. We do see how storytelling can be very effective as a tool, but there is a lot more work that needs to be done. And I think we can learn from countries like Egypt in terms of how to do some of this work. Just for instance, within India, one of the first communities that was affected was, again, the community I grew up in. Which was the Dadi Bora community, and survivors started speaking out about this issue. They started to hear that it was happening in other communities within India. And there were some communities within Kerala, which is more southern India, where it was recognized it was happening. SEO, our organization, we heard stories that was happening in a medical clinic there, and did an investigation and did find proof that it was happening in a medical clinic. We were able to connect with media who actually did their own independent investigation and confirmed what we found, and they were able to highlight it within the media. And we did hear that because of that, what happened there was a demand at the local government within Kerala to put a stop to this. That clinic was shut down, and there was a call for just a lot more stories to come out, and a lot more awareness raising too. So we do see the impact, and we do see how media campaigns can help make a difference there. Also within India, my counterparts in ZAO have been working with some medical communities to help highlight associations that we can amplify through media, that they are coming out and saying that this is something that we should not be medicalizing. So we're seeing variation campaigns happening across the Asian context, and I think that that's really encouraging. There's definitely a lot more work to be done, but I think we can learn from places like Egypt. So Dr. Amar Hassan, thank you so much for sharing your work and what has been done over there. But I'll just say that.
Thank you very much for that, Maria. That's really great, and it's really good to hear that the media is having an impact, especially you know, holding those those doctors to account and stopping medical practice and maybe potentially revoking their license. That I believe that was one of the things that happened in that particular case that you've just shared. I want to now go over to Hoda Ali, and maybe you can come in here and share ways of, so how do you talk about medicalization as a campaigner, Hoda, especially in the context of the UK? We know that FGM is illegal here, and what successes have you had in your campaigns as a nurse, there's a lot of new campaigners who are interested to join, so it would be really super interesting if you can share how have you been able, how should one talk about FGM medicalization as a campaigner? Hoda, over to you.
Hi, thank you for having me, and we got there at the end. I mean, it was amazing to hear from everybody, and I know we had a lot of conversation to cover today. Hopefully one day, if we haven't covered everything, that we can actually come back and do another panel, because Naima, you're amazing to bring people together. So first of all, my name is Hoda Ali. I am a nurse, sexual health and HIV nurse over 10 years. And I am the co-founder of the Vivenges. And right now I work in primary schools, 18 primary schools in Ealing and part of London. It is very important to talk about FGM and harmful practices, especially when girls are very young. So that's one of the reasons I actually left the NHS and I went to education. I really don't know where to start, but I'm going to say as quick as I can, Naima. And please, you have the, stop me if I'm talking too much.
I will do. But go for it.
But talking about FGM and medicalization right now, today in 2020, is actually beyond me. It's something I really thought we're never going to be talking about it, because for years, over 10 years ago, I'm a survivor of FGM, right? And over 10 years ago, I started talking about this. We started campaigning about FGM. I single-handedly went to the hospital and I spoke to doctors and nurses and midwives, where I actually realized they didn't even have the knowledge that they needed to have, because nobody was providing that. FGM was not something that's important for health professionals to know, even though we have safeguarding training every single year. So what can we do? What we can do is that you have to have a voice, regardless of what door that gate is closed on your face. You got to knock every single door. How do you do that? You go to everybody. So I'll tell you a little story. So I worked in Ealing Hospital for about 5 years, and I survived the initial cutting. And this is why it's so important that we need to think about that FGM might not affect that young girl straight away the day that she's been caught. It can affect you later on in life. And this is why when we talk about medicalizing FGM, it really, really brings trauma. It brings trauma to me. So I can imagine that over the 200 million women and girls who are out there who know there is a health professional that who are fighting to cut them is unbelievable. So going back is that you have to believe in your voice and go and speak to the people who make decisions. I lobbied with politicians. I lobbied with chief executives in the hospital. I single-handedly went into the IT department and asked them, as a sexual health nurse, I asked all these questions to my patients. But I never asked them if they had FGM, even though I know they had FGM, because when I go to FGM, so doctors have a duty of care, any health professional have a duty of care, and we need to speak up to make sure that nothing like this, no harm can happen to a girl and a woman, especially in this hospital setting. As a doctor, as a nurse, as a midwife, you have a duty of care. Please tell me the doctor who's going to say to me, it's okay, what happened to you? Tell me the doctor who's going to cut at the little girl, but tomorrow that little girl is going to come back to you as a woman with all the complications that come with it. And they still think it's okay. I think it's time we need to wake up, and it's time we need to talk about the truth and the harmful and what FGM really is. And I do believe any health professional who is for FGM should go to jail. Simple as that.
Wow.
So
Wow.
I'm sorry I
well,
might come off it.
That's a very powerful testimony.
Yes.
No, that's absolutely fine. I think we will just really great to share those experiences. Good to see that you will be lobbying with the government, with the chief execs of hospitals, and there's been some absolutely some progress made, and similarly in the case of the US as well. And it's great to hear from Dr. Hassan in Egypt and to share that experiences. But I would like to now maybe move over to Ayotimiwa in Nigeria, and would be great to hear from a journalist. We've heard from a doctor, we've heard from a campaigner, from both US and UK. I'd love to now hear from a journalist, specifically a journalist that's also been speaking on FGM and the role of how do we make sure that we can get FGM, specifically doctors or healthcare providers, to account, and what's the role that media has to play? And could you share some examples of effective journalism or media campaigns that has had some good results where a medical profession has been held to account?
Okay, thank you so much, Naima, and good afternoon once again, everybody, and thank you for having me here. It's a pleasure to be on this platform. My name is Ayotomiwa Ayodele from Ekiti State, Nigeria, and like I was rightly introduced by Naima, she is a journalist here in Ekiti State. Okay, talking about the fight against FGM, it's medicalization has been quite issue now, at least in the last 3 years. Going by the statistics and the sampling of opinions, you realize that most medical practitioners are guilty of this. You do this to your daughter, but then they go behind and do the perpetrate this act, that's FGM. So what do we from stakeholders, like these nurses, these doctors, they have associations in the state. So we have the Association of Nigerian Nurses, we have the Nigerian Medical Association, we have Association of Resident Doctors. So we had to co-opt their leaders into this fight. But okay, we know some of your members do this. So, and luckily, these people were co-opted into the GBV committee. The state has a GBV committee, but an FGM is an arm of GBV. So what we do is they are now, if you are caught, you lose your license. Definitely, be it a nurse, be it a doctor, you lose your license. So the advocacy has been on, seriously. And because we know this could not have been effective if we are trying to do it on our own as a media advocate. So we have to be part of that fight. So that's how, so far, we know that a strong signal FGM in the state. So far, we're still waiting, we're still on the lookout and hope we will not have a culprit. So nobody loses his license, but then they know that's what you have to do.
Thank you very much, Ayatimuwa. That was great. Really good to see you and good to hear from you and share your experiences in Nigeria. I want to now go to another country. We're going to go to Somaliland. We're going to go to Dr. Mariam Dahir. And your question today, well, my question to you today is essentially around legislation, and I know in Somaliland there aren't any legislations, and the importance of it, and what is the situation there in terms of medical professions who are cutting girls, given that from various different stories and media campaigns we've been doing, it seems to be a growing trend in Somaliland and Somalia regions more broadly. What is happening over there, and have I know the legislation is still a topic, it's like a bit of a hot topic there, and it's a hot spot as well in terms of something that is a lot of people are campaigning for in terms of the FGM bill. But maybe it would be really good to share, what are any stories that you have of healthcare providers that are cutting, campaigns have happened there to kind of shed light to this issue in Somaliland. Over to you, Mariam.
Thank you, Naima. I hope you will hear me very well. As you said, I'm Mariam Dahir from Somaliland. Naima, is that okay?
Yes, fine? You are fine.
Okay, thank you. So I somehow I really got the words of Hodo, and that the doctors are cutting, and tomorrow they will be the healers, and who will be coming. I will start from that side. In Somaliland, I participated in a research that in 2016 we conducted a kind of overall medical doctors who is cutters and all of that, and the prevalence. And in Somaliland, it's the highest country in the world. There was a report just released from UNFPA, and it is 98% of the cuts going on in Somaliland. So in 2016, we discovered that the 5%, it was a 5% of the cutters were doctors, nurses, and midwives. And as well as when we asked the girls who you ever tell your problem is SRH problem, is a reproductive problem, is never been a doctor, nor a nurse or midwife. There were either their mother or grandmother, which means that the girls' health-seeking behavior is very low because the cutters are the health workers who they are going to. So we started campaigning. When we got this kind of information in 2016, we started campaigning, and actually the Somaliland Medical and Nursing, Somaliland Midwifery and Nursing Association is started an initiative to put together the anti-medicalization that will lead any health professional that been caught that cutting the girls in health facility or in the homes, because now they started cutting girls in their homes. We have seen that trend is going on, and actually. So while we were working on that, and actually working with the Minister of Health to legislate and also pass this kind of an anti-medicalization policy at the ministry level, we had a backlash that in 2018, the Minister of Religion Affairs released a fatwa that telling or allowing the medical doctors and nurses to cut the girls in the sunnah type. They prohibited that in that fatwa. They prohibited the pharaonic type 3, but they said it is compulsory to do sunnah, and the one who should cut the girls would be a midwives and nurses and doctors. So this is started really a trend. So in 2019, we did again another research, and there was two findings. We found out that the trend of the medical in 2016, it was only 5%, now it's 25%, while the aspiration of the mothers and family is to cut the girls in clean way and the trend is sunnah. So the people wanted a nurse or doctor or midwife to cut their girls, as well as the So this is a kind of serious issue we have. We are dilemma. I met a nurse in a community, in a rural area, a health center. She was leading a health center. She told me she do three things. When I asked her how she is involved in FGM campaigns, and she said, one, she working with an organization that is ending FGM campaign in their area. So she said, when I'm going with that organization, I always say, I tell people that to stop FGM, all the forms of FGM. When she is in her health center, she performs FGM because she said, I want to save. I already tell them in my outreach, I already tell the people that it is harmful, it's not good to stop FGM. But when they come to the health center, actually I want to stop any except the Caesar. So she cut the girls in her health center. And when I asked her what she wanted to do with her children or her family, she was like saying, maybe I will leave them or small or type 1. So this is, and when she cuts the girls, actually she cuts the girls the way that the mother wants it. If the mother wants to cut the girl in a type 3, she does. So any way that the mother is asking. So this is attitude. It is kind of an example of the attitude of the health workers in Somaliland. They have a zero and awareness or information about what is the consequences of health worker actually to perform FGM. So I have 3 issues that the involvement of the health workers. Actually, I think Egypt and the Ireland, we haven't done such kind of thing, not involving the medical students or doctors. I think I am the 1 or 2 doctors who actually speak out about FGM, and there is only few midwives actually joining this kind of campaign. So the health workers are sidelining that. We really need to learn from other countries how they are doing it, and the advices I really give to the Somaliland teams are health workers have the heart of ending FGM, because now the trend we are seeing is that the aspiration of the community is cutting in medical way. So one of the ending FGM pillars is to be anti-medicalisation law and all of that. In the other area, we have is the legislation, as you said, Naima. We don't have a law. The law is back and forth from the parliament to the campaigners and all of that. And that is also, again, another issue, big issue. The last one I want to end is also there is no health act in Somaliland. So, or what you can say, if I want to criminalize a health worker, there is no code of conduct, clear code of conduct that health worker will lose or will be punished, will lose the license or punished. So this is the areas actually we are struggling, but we are talking about it and putting it on forward, although we need a lot of arms to back up, and like the media. And the only thing we have, and we succeeded, is the campaigns through the media, social media, and all of that, to end FGM in the families, and to speak out and to speak with the youth, and as well as the universities and all of that, the overall campaign. But we really need a campaign that actually focuses the medical doctors and train them and changing their attitude and all of that. Over to you, and thank you.
Thank you very much. Very powerful. We're all here with you, Mariam. We're all here with you, and we're all campaigning with you, and fully willing to keep supporting you in any way possible. I am now going to get one of the attendees up with us. Ayo Bello, who's a campaigner. I think you have a question for our panel. Please go ahead and ask. And then we're going to address some of the questions that are over to you. Go ahead and ask.
Okay, good afternoon. Thank you very much, Naima. I want to say a big thank you to all the panelists. From my experience, when it comes to campaigning for the medicalization of female genital mutilation, in Nigeria, there have been cases of pressure from the citizens on medical practitioners. They don't go to the hospital directly to ask for their daughters to be circumcised, but they go to their houses, when they're back from the hospital, when they're back from work. So the people, these nurses and these doctors, to pressurize them to their girls. So I think that's one of the challenges we have here, because the medical practitioners work with we activists, but they complain of the demand, from the people. So how do we do that? Besides doing our one-on-one sensitization, how do we ensure that we reduce this pressure? Because it's not like the doctors are the ones inviting people to come touch their girls. The people are the ones the problem we can solve very soon.
Thank you for that, Ayo. If you don't mind muting yourself now, thank you. I might give it to Dr. Hassan. I'm not sure whether you've caught Ayo's question. Hello, Dr. Hassan.
Okay.
Yes,
you hear me?
great. Yes, we can hear you.
Yeah. Can you ask me the question? I don't hear it.
Right. So the question is if you can share ways of or stopping doctors to practice FGM in a medicalized way privately. There's a lot of cases of that in Nigeria. From what I heard from Ayo, are there any ways or strategies that you could combat that maybe have been successful in the case of Egypt, for example? Ayo, you can come in and type in your question if I have misunderstood your question, but I believe that was it. But I'll let you answer that.
I have heard it. Yeah, I hear. Here in Egypt, we have a challenge that there is something called the private sector in Ministry of Health. Here we have the Ministry of Health of Population. Inside it, there is a sector which is called private sector. This private sector, it have a charge that checking private clinics, checking private hospitals, checking hospitals that there are no. We are talking to them that we know that there are clinics and hospitals in which FGM done. They always say that their numbers is limited, so they can't go to every clinic and to every hospital. So I think we can, here in Egypt, we can make a great success. If we increase the number of the staff of this private sector in Ministry of Health. Also, I tell them, I don't know, I only want to arrest one doctor while doing case of FGM. If you arrest this doctor, if he is put in the jail and put spot of media about it, all doctors will be afraid from doing again FGM. And this is a case we have in Egypt, the problem that when girls died, maybe doctor may run away and you can catch it. Move after girl die. We have to preventive measure. We want to know that when there is a hospital or clinic which is doing FGM, we have to work to arrest that doctor before doing his crime. We have to arrest that doctor and stopping him from his work. And I think you don't have to arrest all doctors which are doing FGM. If you arrest 1 or 2 or 3 doctors and put a spot of media about them and that their future has been destroyed, this will send a message of fear to rest of doctors who are interested, who are keen to doing medicalization.
Very good. I totally agree with you, Dr. Hassan. I completely agree. I think media can play a big role there, especially on just making an example of a couple of doctors you know, and yeah, we will definitely hopefully a reaction from other medical or healthcare professions to stop cutting, because nobody wants to lose their license or be in prison. So I guess I totally with you there. I just want to ask you particularly again, Dr. Hassan, there's a couple of questions here for you from Abdulrazak Yusuf, who first of all asked if there's an FGM anti-medicalization policy in place in Egypt. Number 2, whether there's any trained media personnel on how to report FGM issues in Egypt. So if you can answer the first one, if there is A, an anti-medicalization policy in place, and B, whether there are any media personnel who are trained on reporting on FGM in Egypt.
I will answer the second question first. No, we don't have like any, we need like to work on that object. We like have a lot of field to work with this personnel to raise an awareness. I think I have seen like some organizations until now, I think that we have a great majority of journalists and media persons who don't know anything about FGM. As I told you before, they only hear about FGM in 3 occasions: National Day, International Day, and when one victim. And so if you look at 3 days from 365 days through the year, I think it's not enough. But if journalist is keen and interested, they will write many and many articles about FGM. If TV presenters and radio presenters are motivated to talk, then they will talk and will make like more and more interviews about to motivate and work more to engage all these media persons, because I think it's powerful weapon, especially when you have illiteracy rate high. We have a problem in Egypt that illiteracy rate among women is about 31%. So this illiteracy rate make FGM is prevalent in Egypt. So I think media has a strong power, especially when illiteracy is prevalent, because the media, I think that the repeated message will put it in the mind. So I think we have to repeat and repeat and repeat the message in order to be present in mind. Do we have like anti-medicalization? Yes, we have, as I told you, like a strategy, but also we have like problems that here sometimes we like could put a strategy, but from my journey, even in the National Population Council, I think that's the problem that we have in Egypt. We have like a problem in monitoring and evaluation. Like we start and then after that, maybe you're not working well on monitoring and evaluation. So I think that we need more and more people who are motivated, more and more people who are thinking that it's a harmful practice, who thinks that it should
Thank you,
be
Dr. Hassan.
shame. We need more people who think that it is shame to be prevalent in Africa, to be prevalent in our countries. I think I will say to them, if FGM is a shame for our country, that 82% of FGM cases is done by medical staff, is shame more and more. And this is shame for us as obstetrician and gynecologists that we have this high prevalence.
completely agree with you, your feelings, and thank you and sharing your experiences there in Egypt, as well as, yeah, very good. I have one more question here, and it's from Aisatu Sise, who asks, has there been any doctors arrested? I think you've mentioned that there has been one arrest made in Egypt, but this also goes to the other panelists too. So perhaps maybe you can, since you're on camera, Dr. Hassan, maybe you can maybe answer that question, yes or no. Has there ever been an arrest, a medical professional or a doctor?
Yes, but sometimes we have like, sometimes lawyer make a pathway for him, that they said that this operation is for medical reason. They say that this operation is done for cosmetic reason. So maybe sometimes the parents with the doctor pay for the parents' money, and the parents will say that she has like a problem in her genitalia and doctor is trying to correct. So I think too, we have to raise also awareness again within police staff, within lawyers, within the judge, that FGM has bad influential effects on girls. So sometimes we have doctors who escape, as I told you in 2016, Mayar died in Suez, and the doctor has run away outside Egypt. Other doctors, when arrested, way for their doctors to escape. Maybe, as I told you, that during the court they say that it was done for cosmetic reason, or it was done that was a medical need. So they work on that maybe the judge don't have enough experience or enough information about FGM.
Thank you very much, Dr. Hassan. I completely share with you. I mean, yes, the law enforcers, the lawmakers, they all need to be retrained and need to take FGM seriously. And I think it's, and in some countries, or especially in practicing countries, even in urban settings, in terms of those that are practicing are also literate. Not necessarily just illiterate, are also literate and have, very, well-to-do, are also cutting their daughters. And there's really an embedded, practice that is part of, I guess, a social fabric for many of our countries, including mine. And it's about changing those social norms, and that absolutely requires all aspects of society, both lawmakers, law enforcers, to also be, and healthcare providers, to all be on the same page when it comes to FGM and protecting women and girls, and centering women and girls first, their health, their well-being, all in all needs to be centered. I totally agree with you there. Now I wanted to maybe pass it on to maybe Hoda. Maybe you can come in here and share. Has there been any doctors arrested here in the UK?
In short, no. We had a couple of years ago, we had a doctor where actually the woman was giving birth, and the husband asked the doctor to make sure that she is stitched up after she gave birth, which is what actually happens to a lot of women in the practicing community. The woman, every time she gives birth, they stitch her up again. And that doctor get away. He was never found guilty. And the reason he was never found guilty, that here in the UK, we do have a law. However, there is a law, there is a gap between the law. And the gap is that doctor who is educated, who have a duty of care of their patient, because regardless of what you do, you have a duty of care. The minute I walk into your clinic, to your office, or you're examining me, are saying we are not educated about FGM. And you know what, when you look at their training record, if they never had FGM training, they can get away with it. And that is one of the reasons that we are saying, regardless if you're in Africa, if you are in Europe, in London or America, is that the law is really weak to protect women and girls. There is a law for medical professionals. If you harm somebody, that you will go to jail. but FGM is not one of it, because it's only now here, even in London, in the UK, we are making mandatory for doctors to be trained, for midwives to be trained, for student nurses and doctors to be trained. But guess what? It's not happening everywhere. And this is why I was saying that we as a campaigners and survivors of FGM actually become the educators. I cannot count how many universities I've been there to actually do FGM training for the midwife to be, the nurses to be, the junior doctors, the general practitioners. They actually do not know. I met at where the patient had type 3 FGM, and the patient needed to have a catheter, and the nurses were trying to do, and they were like, I don't know, but I don't know what this patient is because I can't find their urethra. The doctors came, and this patient was laying on bed, and they had doctors and nurses all around the room, her bed, looking at her, and nobody was talking to the patient. They all talking about her vagina, but nobody looked at the patient. And then one doctor looked to the patient and said, can I ask you this question? And she's like, of course, ask me anything. And he said, were you born a male? Now, I want you to all think about what I just said. There's a woman who had type 3 FGM, and the doctor asked her if she was born a man, because they thought that she had sex change. These are what women going through who are survivors of FGM. No matter where we are one of the richest countries in the world, and we are still asking women what they went through and how they can help. So education, especially here in the UK, is really, really important, but sadly, it's not happening everywhere. And what I would like to do before somebody else talks, I want every single doctor and health professional who might be able to watch this video today to please, if they are for FGM, I want you to come and talk to me. I want to know what makes them think, as a human being, as a health professional, it's okay to advocate FGM. Like I said, I was cut at the age of 7. I got sick at the age of 11 because my period wasn't coming out. My period was accumulating. And I had every single doctor came in, look at my vagina as a child, as a teenager, and still didn't know what was wrong with me. At the age of 26, at the age of 17 is when I first had my period. At the age of 21, I started bleeding where I would bleed for months. At the age of 30, I was told I cannot have my own child after I had IVF and nearly died. At the age of 37, I become premature menopause. So as I talk to you right now, I'm on HRT. I'm supposed to have my menopause when I'm 50, 56, 60 years old. At the age of 37, every right I had as a woman was taken away from me. Every right I had to be a mother was taken away from me. So what I would like to know, if you are a health professional speaking up for FGM, have the balls to come and face me, because I would like to know what makes you think it's okay to do that to a child.
Thank you for sharing that, Hoda. I completely feel you, sister. I feel you, and I am with you, and we are all here with you. And I absolutely agree. Couldn't agree with you more. Which health provider would actually be ever want to put that to let a child go through that and not know all for what? And we're all here with you. But now this is why we're all here, is to really and truly stop these horrific stories from reoccurring. And there's millions of those. There are millions of women out there who are suffering in silence. So we need to just amplify this. And we need to kick off this campaign to stop FGM medicalisation. And today's webinar essentially is all about launching a media campaign against FGM medicalisation. So what we need to start thinking about, what is our hashtag going to be? What is our messages on social media as well as on mainstream media will be to get to hold these medical professions accountable and to start having these conversations like Hoda just said. Speak to those that are in favor of FGM, having these debates. Let people hear, let people understand what is actually, make up their mind. Let's also educate our law enforcers. Let's do all of this, but let's have it all amplified on the media. So without further ado, let's kick off this end FGM medicalisation hashtags. I'm hoping that I can share my screen and you can all see. I'm hoping you can see, but this is it. So what we have is we need to start a poll, and we need to look at these three hashtags, and we need to make a decision today on which one of those three hashtags we will now make a decision on as a collective, so then we can start creating as much noise as possible on social media. And we as Global Media Campaign are committed to support with direct action grants to really amplify and to take action on mainstream media, whether that's TV or radio. So we do offer small grants to countries where FGM is being practiced, particularly in Kenya, Nigeria, Sierra Leone, Somalia, Ethiopia, Guinea and Mali specifically, small grants to really highlight this issue. And the next round of direct action grants will be dedicated to this campaign. So I'm hoping you can all see, and I'm hoping you can all, one of those three options would you select for our collective medicalisation campaign? So we have hashtag Stop Medicalising FGM, we have FGM is FGM, and we have Stop FGM Medicalisation. Maybe we can hear from some of our panelists of what are their thoughts on those three hashtags and which one they would select.
Can I go first?
Go for it, Hoda. Go for it.
Because I was just reading, and to me, it just really floats, which is the first one, Stop Medicalising FGM.
Okay. So we have Hoda with Stop Medicalising FGM, which is clear too. It's a clear message.
This is Maria. Can I go next?
Go for it, Maria. Go for it.
I actually agree. That was the one that jumped out at me, and I think it's very clear because we want to associate FGM with medicalizing. So yes, number one is my choice.
Number one for you. Fantastic. What about, who else do we have here? Do we have Ayatinua? Which one would you go for? As a journalist who probably knows a little bit about what media, what my work within the media space. I personally like Stop Medicalising FGM too, but it would be good to hear from both Dr. Maria Dahir and from Ayatinua as well.
Can I go first?
Go for it. Go for it, Mariam.
We have other things that end in, and so this is maybe we can extract from that and say NFG, and we need to also give that kind. But somehow FGM is FGM resonating me. But I will go for the first one.
Okay. And who else do we have? Sorry, because I'm sharing my screen, I'm not sure who else is here in terms of panelists. But what we will now do is we'll do a quick poll. So just give us a few seconds. I know those on Facebook can also write in the chat box which one would they go for. So we're going to start a quick poll in the next few seconds. Just waiting for my colleague Jeremiah to set that up, and then we can start voting. maybe we will, whilst Jeremiah is getting ready, what we could do is maybe address some of the other comments and questions. I think we have a few questions here. Okay, there's a couple of people that said number 1 or number 3. Number 1, a lot of people are going for stop medicalizing FGM, which I agree with. And that might be good enough for everybody, I think. Maybe we've got enough of people voting, but perhaps we don't need to do a poll. I think it's kind of unanimous, really. Stop medicalizing FGM is what everyone preferred, so I think that's a good idea. There we go. We don't need to vote, guys. That's enough. So now what we will do is we will all need to start tweeting. We will all need to start making noise with that hashtag, stop medicalizing FGM. Right now, I would say, let's start right now, and let's really start getting this out. And whatever stories that you have on that you come across or already have come across that fits this hashtag, that healthcare providers, whether they're nurses, whether they're midwives, whether they are doctors, we need to really bring and highlight these issues. There are millions of girls who are suffering in silence, and it's unacceptable in this day and age that this is happening. So it's all on us, and it's not going to cost us anything with social media, with at least whether it's on Twitter, whether it's on Facebook. Let's start getting this trending in our countries. And as for mainstream media, I would say we are, as a global media campaign, are committed to supporting with media campaigns against all forms of FGM, including medical. To do is, if you have any ideas or proposals we do usually, the next round will be for the 16 days of activism, and if you have any ideas which will be on focusing on FGM medicalisation, please send it over to us. I will type in my email address, so it's naima@globalmediacampaign.org. Send them over to me, and myself and my team will go through them, and we'll see how many we can support. At the moment, because of lack of resources, unfortunately, we can only do direct action grants in Somalia, Sierra Leone, Kenya, Nigeria, Guinea, Mali, Ethiopia. Those are the countries where we are focusing our campaigns. And Gambia, sorry. And Gambia. So let me just repeat those. Gambia, we've got Sierra Leone, we've got Kenya, we've got Nigeria, Guinea, Ethiopia, and Mali. Thank you all very much. Let's make as much noise as possible, and let's stop these girls from suffering. We all have a duty of care and responsibilities. I'm going to stop talking. Whoever else wants to come in, please do, with parting words and last parting advice. From you first, Dr. Hassan, why don't you come in and give one last piece of advice?
For me, I want to say that it was a great pleasure to be today with all these great people. And I think that celebration of International Day of Eradication of FGM should be when we have no more cases of FGM. I always say this in Egypt, that when they said that we have to make ceremony for an International Day, I said that the actual ceremony and actual celebration is that when we say that we don't have any more new cases in our country. And I think that I hope that in one day, and this day can be soon, inshallah, that in all African countries we will celebrate that we have no more new cases of FGM victims. Thank you.
Inshallah, thank you for that, Dr. Hassan. Hoda, do you want to come in with your last parting words?
And yes, thank you once again for having me here. And I'm sorry, everybody, I didn't want to share my story, but it's just, I'm part of the statistics. So instead of using someone else, I'm going to use me, because we're talking about medical. Like I said, we all have a voice. Me and my younger sister are last to be cut. I have nearly 20 nieces who will never ever will go through FGM. FGM stopped in my family. FGM stopped with us. And that was because me, once I got sick and everybody saw what was happening, people started talking about it and actually using the pain that was happening to me. So we all have a voice. Please don't feel like your voice is too small or it's too loud. Use your voice, because that voice, you won't believe how many thousands of women and girls that you are speaking up. And I just wanted to say, on behalf of the 200 million women and girls who are survivors of FGM, because we are not victims, we are survivors, I thank you all. And please use your voice and don't be sorry for it.
Thank you very much, Hoda, for your courage and your for sharing your story. It's moving us all, and it moves me too. And you're absolutely right. In this day and age, it should be unacceptable. We should all use our voice and our platforms, and that's what we're here to do today. Maria, over to you for last parting words and any advice that you might want to share.
Hi, thank you. Yeah, so I want to say thank you also to Naima and to everyone at the Global Media Campaigns and UNFPA for really hosting this webinar and this important conversation and topic. And definitely want to echo everything that Huda said too, and just acknowledge that FGMC is a global issue. And I think we sometimes don't recognize the extent of that, and that there are more than 200 million girls affected. It's just, unfortunately, there are many women, I'm actually one of them, that are not included in those statistics, that we don't have those figures out there. So I think it's important to recognize that this is a global issue, and I think we can all learn from each other, just looking at everything that you all have been doing. You know, it might be new still, this really publicly speaking about this within many Asian contexts, but I think we can learn from the expertise that are not just on this panel, but from people that have been attending and everywhere too. And I also just want to say that I think media campaigns and social media advocacy, all of that is so vital. And one thing that I'm seeing a lot of is that we're seeing it being used by people that do want to promote FGMC. And we're particularly seeing, I'm seeing websites popping up that are guised as medical advice and why you should do this. And I think that that's going to make our work challenging, but I think that we can come together to figure out, how do we combat those new challenges? How do we get correct information out there, and how do we all work together? So I just think it's incredibly important that we're having this topic and we're addressing it, and I'm looking forward to what all we can do together after this webinar too.
Absolutely. Thank you very much, Maria. I couldn't agree more. It really is a global issue, and I think we need to really recognize that, and we all need to support each other and amplify all of our voices and not excluding anyone. And I think it's a really important point that you made there. So thank you. And absolutely, I mean, I will be thanking UNFPA, of course, for helping us with this, giving us this opportunity for today. But before that, I want to hear from Ayatumiwa. Please share any last words, any pieces of advice that you can share with us all on how we can all use our voices to really end FGM medicalization.
Okay, thank you once again, Naima. Well, FGM, as you say, shows it's a global issue, and no age, no race, no religion, or no ethnicity is spared of these danger. So it's something that we all need to come together to address. What brings changes is that when people come together on a cause, let me use Nigeria as a case study currently. We have a protest going on where everybody is united and then results are coming out. So when we are united on a cause and we push for something, definitely we will change the norm, irrespective of how long it has been in existence. And as advocates, I think we need to learn what works for us, understand our terrain and what works in each terrain, so that this can work for you. Because what works for me might not work for you. So try as much as possible to understand what works for you. Identify the relevant stakeholders that can help amplify your advocacy. And with this, I'm sure we would end FGM in our generation. Well, we'll keep the fight. You know, it's something that is going on the ground. Most of the people guilty, the culprits are all going on the ground, all in the name of medicalization. But then, with the right fight, the right tools, and the right stakeholders on our side. I'm sure this is a battle we will win. Thank you.
I echo that. Thank you very much, Ayatimiwa, and thank you for all that you do. Now over to Dr. Marianne Dahin, last but not least. Please, your parting words and also, any advice, recommendations that you could share with us all would be great.
Thank you, Naima, and everybody. Actually, what I want to say is like that kind of campaign is needed in my country most, because we don't have that kind of awareness in the health sector. Even so, we will start to stop medicalizing FGM, and the other issue that, as Hoda said, your voice is not less, you are not that loud, you are speaking to the rights of the people. So sometimes people see me on Twitter, like I speak a lot, I tweet a lot, but what punishes me is more than what I can say. That I see girls being cut by a doctor or a midwife, it hurts me because I know I'm a medical doctor and also survivor of FGM. So putting that together, I will never do that, but I don't know where is the moral of the people. So building the moral, building and coming with the attitude and changing the attitudes and all of that, because I think the health sector is being left behind in this campaign, and we really need to start that. And I hope that the GMC and also the other campaigners can help us building that kind of momentum to build a very powerful messages that can help the health workers to stop FGM. And it is something that we shouldn't be continuing. We shouldn't speak it, as Hoda said, in 2020. So putting it in and adding it in the curriculum, starting the code of conduct, and actually I really wanted GMC to support me to advocate for the anti-medicalization policy at the grassroots level, at the health centers and also hospitals level. So this is what I want to say. Thanks everybody. I got a lot of insights from everybody who was here, Dr. Ammar, Odo, and Maria Tahir. So let us keep speaking. Let us keep this kind of a platform to repeat again and again. Thank you so much.
Thank you very much. I completely agree. We need to keep the conversation going and flowing and sustained, and it's so it's paramount. It's the only way that that hopefully we will be able to reach that ending FGM within 2030 goal, which is completely possible and doable, but it's a lot. There's a lot to do still, and so thank you for that. I would like to play a small film without further ado. It's only 3 minutes, just to kind of put it into context of what we're all here to do and trying to really capture. Of course, Hoda did an eloquent job of explaining her story. Nothing is much more touching than that. But this is another story of another girl that has gone through FGM. But it's also really important to highlight that it's not just an African problem, it's a global issue. This is a story of a child in Singapore, but it's with subtitles, so please let's watch. I'm hoping the technology won't fail me today, and I want to send huge apologies to everybody for my internet issues, but I'm hoping that you can all hear and watch this film. One second, it will be with you now.
Saya berdiri di tepi jalan, memakai pakaian ringkas, kemeja T dan seluar jeans, menunggu ayah menjemput saya dari universiti. Kami sedang menuju ke rumah ibu saudara untuk acara ulang tahun sepupu saya Anissa yang berumur 2 tahun. Assalamualaikum, saya ucapkan semasa memasuki kereta. Ibu bapa dan kakak saya membalas, Waalaikumsalam. 20 minit kemudian, kami tiba di rumah ibu saudara. Dan terus terbau aroma masakan rendang, lodeh dan sambal goreng yang enak. Rumahnya penuh berwarna-warni. Daripada baju kurung merah dan biru kepada jubah hijau, saya mengambil makanan untuk ibu dan diri saya. Dan kami duduk sambil menikmati makanan lazat. Makcik saya membawa sepupu saya yang comel dan dengan bangganya berkata, dia disunatkan minggu lepas. Mata saya terbeliak. Tulang belakang saya menjadi lurus. Saya hampir terjatuh dari sofa. Dia disunat? Anak perempuan disunat? Saya bertanya. Saya tidak boleh percaya jawapannya. Ya, minggu lalu oleh seorang doktor. Cepat sekali. Snip, dah habis pun, makcik saya menjawab. Tetapi ini melanggar hak kemanusiaannya. Ini salah. Saya menjerit. Kakak saya memotong perbualan kami. Dia berkata, kamu juga disunat semasa kamu kecil. Mulut saya digantung terbuka. Itulah saatnya saya sedar tentang sunat perempuan dan saya mendapat tahu ia telah berlaku kepada diri saya. Tetapi, mengapa? Untuk apa? Saya menanya ibu. Ibu menjawab, dalam Islam, perempuan patut disunat. Cara ini lebih bersih. Dan kamu tidak akan berzina. Pada saat itulah, saya memutuskan untuk mencabar mitos-mitos sebegini dan melindungi anak-anak perempuan lain di Singapura. Dan sejak itu, saya telah berkempen untuk puan.
So that's it, everybody. Thank you very, very much for all of your contributions. And thank you to my stellar panelists again for an incredible session today. Apologies for all the technical glitches. I'm sure that we'll have some more of these sessions again. I want to thank UNFPA for helping us for supporting us in making these sessions happen and have these really important conversations. Now it's time to get back to work, guys, and let's get that hashtag trending. Stop medicalizing FGM, and let's all get together. Let's all support each other, and we're all here to amplify each other's work, especially here as a global media campaign. So, without further ado, I know we've extended our time slightly, by a lot actually. But yeah, thank you all for your time, and hope to see you soon for another round of webinars.